Welcome to today's presentation. Hello everyone, I'm Dr. Sandip Parekh, and I hold a PhD as well as a Master of Physical Therapy degree with a specialization in musculoskeletal and sports management. Today, I'll be discussing the management of acute soft tissue injuries, which is a crucial aspect in sports medicine. Understanding these injuries quickly and effectively is vital because soft tissue injuries, like sprains, strains, or contusions, are very common in athletes and active individuals. The key to successful management lies in early assessment and intervention. We'll look into how to properly evaluate the severity of these injuries, which helps us decide on the best course of action. Immediate care often involves rest, ice, compression, and elevation, what we call RICE, because these measures help reduce pain and swelling right from the start. Additionally, I'll emphasize the importance of tailored rehabilitation plans that promote healing without risking further damage. The goal is to restore function as quickly and safely as possible, minimizing downtime and preventing future injuries. Throughout this presentation, I'll connect these management principles to broader concepts in sports injury treatment, highlighting how timely and appropriate responses can make a significant difference in recovery outcomes. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. So this slide highlights an interesting piece of sports medicine history. In 1978, Gabe Mirkin was the first to coin the phrase RICE, which stands for rest, ice, compression, and elevation. These 4 simple steps became a cornerstone for the acute care of athletic injuries. What's really important here is that this approach was designed to manage injuries immediately after they happen, helping to reduce swelling and pain and promote healing. By understanding the origins of RICE, we can see how these basic principles have shaped current injury management strategies. It also emphasizes the importance of early intervention in sports injuries, which is a key theme throughout this presentation. Recognizing these foundational concepts helps us appreciate how far sports medicine has come, but also how these simple, effective methods remain relevant today. Let's talk about the RICE method, which is a fundamental approach for managing injuries. First, R stands for rest. It's important to rest the injured area, which often means taking 2 to 3 days of immobilization to prevent further damage. Next is I for ice. Applying ice helps reduce pain and muscle spasms, and it also minimizes cell death. Plus, ice causes vasoconstriction, which means it narrows blood vessels and limits swelling. Then we have C for compression. Using compression, like an elastic bandage, helps decrease swelling by slowing the flow of fluid to the injured area. Finally, E stands for elevation. Elevating the injured limb encourages blood flow back toward the heart, which also helps reduce swelling. Putting it all together, the RICE method is a simple yet effective way to manage injuries early on, minimizing damage and promoting healing. It ties into the overall theme of injury management by emphasizing prompt, appropriate care to get you back on track faster. Now, let's take a closer look at some of the variations of the RICE protocol. First, we have HI-RICE, which stands for hydration, ibuprofen, rest, ice, compression, and elevation. This version emphasizes the importance of staying well hydrated and using over-the-counter anti-inflammatories like ibuprofen alongside the standard RICE steps. It's especially useful for managing inflammation and promoting healing. Next, we have PRICE, which adds protect to the original RICE. Protecting the injured area, often with crutches or supports, helps prevent further damage. The idea is to shield the injury from additional trauma while you rest, ice, compress, and elevate. Then there's PRICES, which further includes support, such as bandaging or tapping. Supporting the injury provides stability and can help reduce movement that might worsen the injury. This approach is often used in more severe cases or when additional stabilization is needed. PRINCE introduces the use of NSAIDs instead of just general ibuprofen, highlighting the role of specific anti-inflammatory medications in pain management, along with the other steps: protection, rest, ice, compression, and elevation. Finally, Reiser adds referral into the mix. This is particularly important because it encourages seeking professional medical advice when necessary, especially if the injury doesn't improve or worsens despite initial self-care. And as you can see, there are modifications to the basic RICE protocol, each tailored to different situations or injury severities. The key takeaway here is that while RICE provides a solid foundation, adapting the approach based on the specific injury can improve outcomes and ensure proper healing. This slide doesn't contain enough information. That's why we're moving to the next slide. So here on this slide, we see that the price needs updating. This is an important point because prices are a key part of our overall strategy and customer perception. If the prices are outdated or incorrect, it can lead to confusion or even loss of trust with our clients. Now, the question we're raising here is, should we call the police? Well, in this context, it's a bit of a metaphor. It's about whether we need to escalate the issue or involve authorities if the pricing problem is part of a larger problem like fraud or misconduct. This ties back to our overall theme of ensuring transparency and accuracy in our operations. So the main takeaway is that updating pricing is crucial, and we need to consider the appropriate steps, whether that's internal adjustments or involving external parties, based on the situation. This slide doesn't contain enough information. That's why we're moving to the next slide. Today, I want to highlight a study conducted by Bleakley, Glasgow, and McAuley in 2012, published in the British Journal of Sports Medicine. They suggested that some of our current approaches need updating, and in fact, they went as far as to say we should call the police when it comes to managing injuries. Now, this isn't about calling the actual police, of course, but rather about a useful acronym: POLICE. POLICE stands for Protect, Optimal Loading, ICE, Compression, and Elevation. These are the key principles we should consider for effective injury management. Protect refers to preventing further harm or aggravation of the injury. Optimal loading emphasizes that, rather than complete rest, controlled and appropriate activity can actually promote healing. ICE helps reduce swelling and pain, while compression minimizes swelling and provides support. Elevation encourages fluid drainage from the injured area, further reducing swelling. The takeaway here is that these principles form a comprehensive, evidence-based approach to managing injuries, and updating our practices with this in mind can lead to better recovery outcomes. It's about moving away from outdated ideas of complete rest and embracing a balanced, strategic method to injury care. This slide doesn't contain enough information. That's why we're moving to the next slide. Optimal loading is achieved by utilizing mechanotherapy intervention, which includes a wide range of manual techniques. The key idea here is that the right amount of activity can actually help in managing edema. For example, when we consider the ankle, contracting the calf muscles plays a crucial role in moving swelling up the body, working against gravity. Complete rest, on the other hand, would prevent this effective drainage. So, the concept of optimal loading balances activity and rest to promote healing and reduce swelling efficiently. This approach aligns with our overall theme of encouraging active recovery to support tissue repair and function. Everyone wants to be heard, recognized, and valued. It's such a fundamental part of our human nature. We all seek connection and understanding, whether in our personal lives or within organizations. When we talk about effective communication or leadership, this desire to be acknowledged is at the core. Recognizing this universal need helps us build better relationships, foster trust, and create environments where everyone feels engaged. Remember, no matter who we are or where we come from, this basic human want remains the same. It's a powerful reminder of why empathy and active listening are so crucial in everything we do. This slide doesn't contain enough information. That's why we're moving to the next slide. This slide doesn't contain enough information. That's why we're moving to the next slide. Recently, Dubois and Esculier in 2019 introduced two new acronyms, PEACE and LOVE, to help optimize soft tissue recovery. These concepts really emphasize the importance of patient education, making sure patients understand their injury and recovery process. It's also crucial to address the psychosocial factors involved, like motivation, mental health, and support systems, because these can significantly influence healing. What's particularly interesting is how these acronyms highlight the potential harmful effects of relying too much on anti-inflammatory medications during recovery. While these drugs are common, they might actually impede the healing process if used excessively or inappropriately. Overall, peace and love serve as a reminder that recovery isn't just about physical healing. It's about a holistic approach that includes education, mental health, and cautious use of medications, aligning well with our overall theme of patient-centered, effective rehabilitation. Today, I want to focus on the importance of unloading or restricting movement for about 1 to 3 days after injury. This initial step is crucial because it helps reduce bleeding, which can minimize swelling and inflammation. By limiting movement, we also prevent the injured fibers from distending or stretching further, which can worsen the damage. Reducing movement early on is about preventing additional injury, giving the tissues a better chance to start the healing process. It's important to note, though, that while rest is necessary initially, prolonged rest can actually be harmful. Extended periods of complete rest can compromise tissue strength and quality, making recovery more difficult in the long run. That's why we want to let pain be our guide when it comes to removing protective measures and gradually reloading the injured area. Pain signals help us understand when it's safe to start moving more confidently again. And this ties into the core idea of the P principle: protect. Protecting the injured tissues during the initial healing phase sets the foundation for a good recovery. So, in essence, a careful balance of rest and gradual reintroduction of movement is key to promoting optimal healing. Let's talk about elevating the injured limb. The key idea here is to keep the limb higher than the heart. This simple action actually helps promote the flow of interstitial fluid out of the injured tissue. By elevating, we can assist in reducing swelling and improving circulation around the injury site. Now, even though the evidence supporting elevation is not very strong, it's still widely recommended. The reason is that the potential benefits are low risk, so it's a safe and easy step to include in initial injury management. Remember, the concept of elevation ties into the overall goal of controlling swelling and promoting healing. So, whenever possible, elevate the injured limb to support a better recovery process. Let's talk about anti-inflammatory medications and their impact on tissue healing. While these medications are often used to manage pain and inflammation, they can actually have some downsides when it comes to long-term tissue repair. In fact, they may negatively affect the healing process over time. Now, it's important to understand that optimal soft tissue regeneration relies on the different phases of the inflammatory process. Inflammation isn't just something to be suppressed, it's a vital part of healing. It helps to clear out damaged tissue and set the stage for new tissue growth. So, when medications are used to inhibit this inflammatory response, it can actually impair the healing process. That's why, in many cases, we should be cautious about relying on anti-inflammatory modalities during the healing phases. This is why, in our approach, we recommend avoiding anti-inflammatory modalities when possible, especially during the critical phases of tissue regeneration. By doing so, we support the body's natural healing mechanisms and promote better, more effective recovery. Let's take a closer look at the authors and their affiliations. Peter Jones, Rain Lambdin, and Stuart R. Dalziel are the researchers behind this study. Jones and Lambdin are from the Adult Emergency Department at Auckland City Hospital in New Zealand, which highlights their focus on adult emergency care. Dalziel is affiliated with the Departments of Surgery and Pediatrics, Child and Youth Health at the University of Auckland, emphasizing their expertise in both surgical and pediatric care. This study was published in the Cochrane Database of Systematic Reviews in 2020, specifically in Issue 8. The research compares oral nonsteroidal anti-inflammatory drugs, or NSAIDs, with other oral analgesic agents for treating acute soft tissue injuries. The key point here is that NSAIDs are commonly used for pain relief in soft tissue injuries, but we need to understand how they stack up against other pain medications in terms of effectiveness and safety. This comparison is important because choosing the right analgesic impacts not only pain management, but also patient recovery and safety. So, as we go through the evidence, keep in mind how these findings can inform our clinical decisions and improve patient outcomes in emergency and pediatric care settings. Let's talk about pain first. The evidence we have is of low certainty, which means we're not very confident in the results. Essentially, there appears to be no significant difference between NSAIDs and paracetamol when it comes to pain relief at day 7 or later. The average difference is about 1.55 millimeters on the pain scale, but the confidence interval ranges from -0.33 to 3.43, meaning it could favor either treatment or show no real difference. This data comes from 4 studies involving 467 participants, and the p-value of 0.11 suggests no statistically significant difference. Moving on to swelling overall, the evidence is also of low certainty, indicating we should be cautious in interpreting these results. One study, Lietzi's 2011, with 86 participants, reported a statistically significant difference at day 3 favoring paracetamol. Specifically, the swelling measured by volume was about 4.3 milliliters less in the paracetamol group, with a confidence interval from 0.79 to 7.81. But here's the catch. This difference was considered clinically unimportant, and the study used a suboptimal dose of paracetamol, which might have influenced the results. So, in summary, the evidence suggests that both medications are quite comparable in terms of pain and swelling outcomes, but the certainty of this evidence is low. This highlights the importance of considering clinical significance and study quality when interpreting these findings. So, when we compare NSAIDs to paracetamol, the evidence suggests that NSAIDs do not make a significant difference in pain relief at 1 to 2 hours after treatment, nor at 2 to 3 days. In fact, high-certainty evidence indicates that they probably don't improve pain outcomes during these periods. Looking further out, at a week or beyond, the evidence is less certain, low certainty, that NSAIDs may still not provide additional pain relief compared to paracetamol. Regarding swelling, the evidence is again low certainty, but it suggests that NSAIDs might not have much impact on reducing swelling after a week or more. We're also uncertain about whether NSAIDs help people return to their normal activities or function after a week or longer. This is very low certainty evidence, so we can't draw strong conclusions there. On the safety side, there's low certainty evidence that NSAIDs might slightly increase gastrointestinal adverse events, like stomach issues, but they probably don't make a difference in neurological adverse events compared to paracetamol. Overall, these findings highlight that NSAIDs may not be vastly more effective than paracetamol for pain or swelling in the longer term, and they carry some small risks. This connects to the broader theme of carefully weighing the benefits and risks when choosing pain management options. Let's talk about avoiding ice. Ice can be a major hazard in many environments, especially during transportation or outdoor activities. It's important to recognize that even a thin layer of ice can make surfaces extremely slippery and dangerous. So, one of the key points is always to check your environment carefully. Look for ice on roads, walkways, or equipment before working or moving around. Using proper de-icing methods, like salt or sand, can significantly reduce the risk of slips and falls. And remember, when in doubt, take extra precautions. Walk slowly, use handrails, and wear appropriate footwear with good traction. Connecting this to our overall theme of safety and preparedness, avoiding ice is about being proactive. It's about assessing the risks and taking steps to prevent accidents before they happen. Staying vigilant and prepared helps us maintain safety in challenging conditions. Let's talk about the use of ice in soft tissue injuries. Many of us think of ice as an effective way to manage pain and swelling, and it's widely accepted as an intervention. However, the interesting part is that there's actually very little high-quality evidence to support its effectiveness in treating these injuries. In fact, applying ice might do more harm than good in some cases. It can potentially disrupt the natural inflammatory process, which is crucial for healing. For example, inflammation, angiogenesis, and revascularization are all key steps in tissue repair, and cold therapy might interfere with these processes. Additionally, ice could delay the infiltration of important immune cells like neutrophils and macrophages, which are essential for clearing debris and kickstarting healing. There's also some evidence suggesting that ice might increase the presence of immature myofibers, which are less effective in rebuilding tissue properly. All of these factors can lead to impaired tissue regeneration and even cause redundant collagen synthesis, which may result in less optimal healing outcomes. So, based on this evidence, I recommend avoiding the routine use of ice for soft tissue injuries. Instead, focusing on other evidence-based approaches might be more beneficial for proper recovery. So, based on the review by Bruno Venancio Alexander, Christina Laverde Beixinho, and Maria do Seu Sá from 2021, we see that there is currently no solid evidence to confirm the effectiveness of specific protocols for managing soft tissue injuries around the ankle joint. This highlights a significant gap in research, meaning that we still don't have definitive scientific backing for particular treatment methods in this area. However, despite this lack of conclusive evidence, there are some good practices that are generally recommended by clinicians. These include applying ice, elevating the limb, and engaging in what we call optimal loading. The idea behind optimal loading is to gradually introduce stress to the injured tissue, which can help promote better healing. The key point here is that progressive loading, carefully increasing activity as tolerated, appears to support the restoration of collagen strength and improve the tissue's structural characteristics over time. So, while we await more definitive research, these practical, evidence-informed strategies can still play a valuable role in managing soft tissue injuries effectively. This connects back to our overall theme of combining evidence with clinical judgment to optimize patient recovery, especially in areas where scientific certainty is still developing. Let's talk about how intra-articular edema and tissue hemorrhage can be managed effectively. One common approach is through external mechanical compression, such as tapping or bandages. This method helps limit swelling and bleeding within the joint and surrounding tissues. When we apply compression, we're essentially providing a gentle pressure that can reduce fluid accumulation and control bleeding. It's important to understand that compression is a key part of the overall management strategy because it not only helps with swelling, but can also improve comfort and support joint stability during the healing process. So, when you see the QC for compress, remember that this simple intervention can make a significant difference in controlling intra-articular edema and tissue hemorrhage, ultimately supporting a smoother recovery. It is our responsibility as physiotherapists to educate our patients on the many benefits of an active approach to recovery instead of a passive approach. When we talk about education here, we're emphasizing the importance of empowering our patients with knowledge. We want them to understand that staying active during their rehabilitation can significantly improve their outcomes. An active approach encourages engagement, responsibility, and confidence in their ability to recover. It's crucial that we communicate these benefits clearly, so patients see the value of participating actively in their therapy. Ultimately, educating our patients helps foster a mindset that recovery is a collaborative effort, and their active involvement makes a real difference. This aligns perfectly with our overall goal of promoting sustainable, long-term health and mobility. After the first day has passed, it's really important to remember that soft tissues need love too. This means giving them the proper care and attention to promote healing and prevent complications. Soft tissues, like gums, muscles, and other connective tissues, are delicate and can be easily affected by trauma or improper handling. So, just like with other parts of the body, they require gentle treatment, good hygiene, and sometimes specific interventions to support recovery. This is a key point because, in our overall approach to patient care, we often focus on the more obvious areas, but soft tissues are just as critical. They play a vital role in healing, comfort, and function, especially after procedures or injuries. So always remember, after the first day, soft tissues need love. They need our attention, care, and patience to heal properly and ensure the best outcomes. Let's talk about early mechanical stress and how it plays a role in tissue healing. When we introduce some loading early on, it's important that this loading is optimal, meaning it doesn't cause increased pain. This balance is crucial because it encourages the body to repair and remodel tissue effectively. By applying the right amount of load, we actually promote the processes of tissue adaptation. This is where mechanotransduction comes into play. It's the mechanism by which tendons, muscles, and ligaments sense and respond to mechanical stimuli. Essentially, this process helps build tissue tolerance and increases the capacity of these tissues to handle future stress. Remember, the goal here is to stimulate healing without overloading the tissues or causing setbacks. And just to clarify, the key here is load, represented as L. Appropriate loading is a fundamental part of rehabilitation because it guides the tissues to strengthen and recover properly. The brain plays a very important role in rehabilitation interventions. It's not just about physical recovery, but also about how the brain adapts and rewires itself during the process. Understanding this helps us tailor interventions that are more effective. Now, when we talk about barriers to recovery, psychological factors are often overlooked, but they are just as crucial. For example, depression can significantly hinder progress because it affects motivation and engagement with therapy. Fear is another barrier. Fear of re-injury or failure can prevent patients from fully participating in rehabilitation activities. And here's a key point. Maintaining optimism, or O, can make a real difference. A positive outlook can boost resilience and encourage persistence through challenging times. So, fostering optimism isn't just a feel-good thing, it's a strategic part of successful recovery. All of these factors, brain involvement, psychological barriers, and optimism, are interconnected and emphasize the importance of a holistic approach to rehabilitation. It's about addressing not just the physical aspects, but also the mental and emotional ones to optimize outcomes. When managing musculoskeletal injuries, it's essential to incorporate cardiovascular physical activity into the treatment plan. Now, you might wonder why that is, especially when dealing with musculoskeletal issues. Well, early mobilization and aerobic exercise play a crucial role here. They don't just help patients recover faster, they actually improve overall function, allowing individuals to get back to their daily activities and work more effectively. Plus, engaging in these activities can reduce the reliance on pain medications, which is always a positive outcome, minimizing potential side effects and dependency issues. An important concept to keep in mind is V, which stands for vascularization. Improving blood flow through aerobic activity enhances healing by delivering more oxygen and nutrients to the injured tissues. So, integrating cardiovascular exercise early on isn't just about fitness. It's a strategic move to enhance recovery, improve function, and support overall well-being in people with musculoskeletal disorders. Evidence really supports the use of exercise therapy when treating ankle sprains. Not only does it help in recovery, but it also actually reduces the risk of a recurring injury down the line. Let's talk about the benefits of exercise. First, it helps restore mobility, which is crucial after an injury because regaining movement means you're on the way to full recovery. Second, it rebuilds strength in the injured area, ensuring your ankle can handle daily activities and sports again. Third, it restores proprioception. That's your body's sense of position and balance, which is often affected after an ankle sprain, especially early on. Restoring proprioception early helps prevent further injuries. Now, during the subacute phase, it's really important to avoid pain. Pain can be a helpful guide. It signals us to slow down or modify exercises to promote proper healing. Using pain as a guide allows us to progress exercises gradually, increasing difficulty only when your body is ready. Remember, the goal of exercise is to support the healing process, rebuild function, and prevent future injuries. So, Integrating this approach into your rehab plan is key to a successful recovery. This slide doesn't contain enough information. That's why we're moving to the next slide.